One of the important topic, that is osteoporosis, and it is one of the bone disease. Here two terms is there. One is osteo, another is porosis. Osteo means bone and porosis means pores. Here you can see one is healthy bone, another is osteoporotic bone. Healthy bone is intact, in but in osteoporotic bone pores is there or fracture is there. So next, here contents you have to know: definition, etiology, sign and symptoms, pathogenesis, complications, management of osteoporosis. Next, you have to know the definition. Here, osteoporosis is one of the metabolic skeletal disease, and main characteristics of that: a low bone density and micro architectural deterioration of bone tissues. Here, commonly affected site of osteoporosis are vertebrae, wrist, and hips bone. Here you have to know the cause of etiology of osteoporosis. Etiology means cause of osteoporosis. What are the causative factors or risk factors is there? Here you can see females are mostly affected. Then osteoporosis is occurred due to inadequate intake of calcium and vitamin D, lack of physical activity due to alcohol consumption and smoking, estrogen deficiency, low weight and body mass index, and due to some disease conditions like hyperthyroidism, renal disease, rheumatoid arthritis, diabetes mellitus, and leukemia. And drugs like some phenobarbital, corticosteroids. These are the causative agents for osteoporosis. Then you have to know the sign and symptoms of osteoporosis. Some signs like pain is there, back pain as well as neck pain and local side pain where it is affected. Or you can see a stooped posture, a carved spinal cord will be carved like structure, and there will be weak and brittle fingernails. Complications you have to know. Here main complication is bone fracture, particularly in hips bone and vertebrae bone, spine bone and hips bone. Next you have to know the management. In management you can use medication as well as some other thing is there. In medication, calcitonin is there, raloxifene, alendronate, risedronate, and hormone replacement therapy is there available. And in some non-pharmacological therapy also used, like calcium rich diet should be taken, alcohol consumption should be avoided, exercise regularly, and should stop smoking. Pathophysiology of osteoporosis. Here you have to know the composition of bone, and in bone two things is there: matrix and cells is there. In matrix you see collagen, then calcium. Here collagen is present in bone, which is organic matrix, and calcium is there, which is inorganic matrix. Here you have to remember this. And four types of cell is present in bones, that is osteoprogenitor bone, osteocytes, osteoblast, and osteoclast. This osteoblast and osteoclast is very important cell present in physiology. In normal bone there will be balance between osteoclast and osteoblast, and main function of osteoclast is bone resorption and osteoblast is bone formation. But in case of when this balance will be when there will be no balance between these two cells, there will be formation of osteoporosis. It is known as bone remodeling. Again, one thing is there, peak bone mass. Suppose you know peak temperature, peak viscosity, peak pH. Peak pH means at the maximum pH at which the activity of pH will be maximum. And here peak bone mass means maximum bone maturity. That means during age 25 and 35, or you can say 30 years, there will be maximum bone growth or maximum bone maturity. But after that 30 years, then bone strength will be decreases gradually. Subsequent loss of bone strength or bone maturity, there will be um, this is the main reason for the weakness of bone, and it also leads to osteoporosis. And you see three things is there: calcitonin, estrogen, and parathormone. And due to increasing age, this activity of calcitonin, estrogen, and parathormone is decreased and something is increased. Parathormone activity is increased, but parathormone is not good for bone that much, as because parathormone during increasing age, this parathormone leads to bone resorption, or it will decrease bone strength, and estrogen activity will be decreased, as because main function of estrogen is inhibit bone breakdown. But when age is increasing, estrogen level also decrease, inverse action. So here bone breakdown, chances of bone breakdown will be increased, and calcitonin function also decrease while age is increasing, and main function of calcitonin is bone formation. So this is the main pathophysiology behind of osteoporosis. Thank you.